All right, today we're diving into something that is a true medical emergency. It's a condition where a virus that's been lying dormant in your body, maybe since you were a kid, suddenly wakes up and threatens one of our most precious senses, our sight. It's called Herpes Zoster Ophthalmicus, and we're going to break down exactly what that means. And to help us navigate this pretty complex topic, we're using this fantastic clinical summary from Dercat Premium Revisions. It really lays everything out for us nice and clear.
So this really gets to the heart of it, right? What happens when that chickenpox virus you had as a kid, the one you thought was long gone, decides to make a comeback and attack your eye?
So here's our game plan for today. We're going to follow the entire journey of this virus, how it wakes up, the telltale signs to look for, the real damage it can do to the eye, why it's such a race against the clock to treat it, and finally, what the aftermath can look like.
Okay, first things first. Where does this even come from? Well, the story actually starts decades before you ever see a single symptom, with a virus that, well, it never really leaves your body.
So here's the bottom line. HZO is basically shingles, but in a really specific and really dangerous spot. Remember the Varicella-Zoster Virus, or VZV? Yeah, that's the chickenpox virus. It just hangs out, hiding in your nerve cells for years. When it decides to reactivate along the nerve that goes to your forehead and your eye, that's the V1 branch, boom, that's HZO.
But why? What wakes the sleeping giant up? Usually it's because your immune system is a bit down for the count. This could be because of getting older, certain conditions like HIV, medications like steroids, or even just a period of really intense stress. Basically, when your body's defenses are lowered, the virus sees its opening and takes it.
So the virus is awake. Now what? How does this internal problem start to show itself on the outside? Well, the signs are actually super distinctive if you know what you're looking for. You know, what's interesting is that it doesn't just start with the rash. Nope. First, there's what's called the prodromal phase. You might just feel kind of blah, a fever, feeling unwell, but also this really severe, deep pain on just one side of your head or around your eye. Then, after all that, the classic blistering rash finally erupts in that same area.
And this is one of the biggest clues for any doctor. The rash does not cross the midline of the face because the virus is just following one nerve path on one side of your body. The rash literally stops right down the middle. It creates a really stark, clear boundary.
Okay, everyone, lean in for this one. This is so important. If you see a little blister on the very tip of the nose, that's called Hutchinson's sign, and it's basically a 5-alarm fire. Why? Because the nerve that goes to the tip of your nose is a branch of the same nerve that goes deep inside your eye. So that little blister is a huge red flag that the eye itself is in serious trouble. And that brings us right to the heart of why this is such an emergency. Once the virus gets to the eye, what's the actual danger? What can it really do?
Well, it can do a lot. The virus can unleash this wave of inflammation and damage pretty much every part of the eye. We're talking conjunctivitis, keratitis, that's inflammation of the cornea, the clear front of the eye, and it's the #1 cause of vision loss from HZO. But it doesn't stop there. It can also cause uveitis, scleritis, mess with the retina and optic nerve, even jack up the pressure inside your eye. It is a full-on assault. So, when you're facing a threat that's severe, you can't waste a second. The response has to be fast. We are talking about a true race against the clock.
72 hours. Burn that number into your brain. Why? Because starting antiviral treatment within 72 hours of that rash first appearing is your absolute best shot at preventing the worst complications. You wait longer than that, and the risk of permanent damage starts to climb. A lot.
So how do doctors know for sure? Honestly, most of the time, they can diagnose it just by looking. That classic one-sided rash, the symptoms, it paints a pretty clear picture. But the single most important non-negotiable step is getting to an ophthalmologist, an eye specialist, immediately for a full exam to see what's happening inside the eye.
And the main weapon in this fight is a course of high-dose oral antiviral medication. You'll see options like acyclovir, valacyclovir, or famciclovir. The goal is to get on these for about a week to 10 days to stop that virus in its tracks and hopefully lessen the damage.
Okay, so what happens if treatment is too late, or if it's just a really nasty case? And maybe more importantly, is there any way to stop this from happening in the first place?
The long-term fallout can be really serious. I'm talking about permanent vision loss, scarring on the cornea, and then there's something called postherpetic neuralgia. This is a brutal, chronic nerve pain that can stick around for months or even years, long after the rash is gone. It's just awful.
But after hearing all of that bad news, it is so important for you to know that prevention is possible.
And here's how you do it. The Zoster vaccine, you probably know it as the shingles vaccine, is incredibly effective. It's recommended for older adults and other high-risk people to really boost their immune system against this specific virus and just keep it locked away for good.
All right, let's boil this all down. What do you absolutely need to remember? 1. HCO is shingles attacking the nerve that goes to your eye. 2. That little blister on the nose, Hutchinson's sign, is a major red alert for eye involvement. 3. You have a 72-hour window to start antivirals to prevent the worst outcomes. And 4. This is always an emergency that needs an urgent trip to an eye specialist. It's not something you wait on. But really, the biggest takeaway of all is that this is largely preventable, which kind of makes you think, doesn't it? What's stopping us from making this awful, sight-threatening condition a thing of the past?